How y'all doing? It's Thomas over at Spire Rehab Center. I'm the lead physical therapist we got here. I need a haircut. Oh my goodness. But tell you what, we got a lot of people walking here with chronic persistent issues, chronic persistent pain. And I think a lot of people don't realize is there is a lot you can do on your own to calm things down. And personally, that's a goal I have for everybody watching here. I want you to be able to manage this to the best of your ability on your own. As I often talk to people about, a problem you understand is a heck of a lot better problem you don't understand. Personally, the chandelier I bought from Menards, out front, on my porch. Didn't understand how to do it. Took me forever. I hated it. It was awful. Stressed me out. My neck hurt. Second time, mother-in-law bought me one. Thanks. From Home Depot, better idea, and it was much easier. Okay, so, we got to understand what's going on. We got to understand our problem. So there's different ways where you can calm that system down. And we know that when people are experiencing persistent issues, and persistent pain, it acts differently than it does acute issues. We know there's a lot more evolved with the sensitivity of the system. Research has shown that. So that pain is, if we think about it as a giant pie, yes, the tissues are a part of that pie, and that we need to address those tissues. There's different ways we can do that with stretching, with some of the work with our hands, whether it be maybe with the decompression machine, or different things. We can address the tissues, but we got to address those other things as well, because, the tissues could be in tip-top shape and we still have a lot of pain. We know that with MRI research that, as we get older, disc bulges, disc degeneration normally happens. And look it up. It's in big studies, not little studies, big studies. So it naturally happens, but that doesn't necessarily mean it's got to lead to pain. So we want to address outside the tissue. So what are things we do? One, sleep. If you're not sleeping well, if you haven't slept well for a long time, go talk to your doctor about that. There's different things that, maybe you'd be good for a CPAP machine. I'm not a sleep expert myself. The easy things I tell people are wake up and go to sleep at the same time each night. Make sure it's dark. Make sure it's cool. Stay away from those laptops, all the computers, the cell phones, the tablets, all that jazz for at least an hour or two before you go to bed. It affects the melatonin levels or something like that. Do different things that can help ramp you down, progressive relaxation exercises. Have some white noise going on. They got a bunch of that stuff on YouTube if you want to look up progressive relaxation. So sleep's a big component of it. They've even found in some preliminary studies that if you're not sleeping well, it can lead to problems, issues. 2, we got stress management. If you're not taking time throughout your day for yourself, the body can kind of view that, and pain's a way of saying, hey, there's something wrong. I don't feel like I'm going to keep going on, and stress can be overbearing, and pain's a way of just bringing it to the forefront for you, saying, hey, something's going on. So, if your job's overwhelming or it's really stressful and you just don't see an end in sight, that could be something that's kind of helping light up the body. It's not helping out. I've seen that with a few different people, of that it's issues with stress, and they go to take a vacation. They're like, man, I felt great on my vacation, but when I came back, not so much. So stress plays a role in it. How much? Everyone's a little bit different. Everybody's little pie is a little bit different. I like blueberry pie. I want a blueberry pie this weekend, but I'm too busy to make one, and I don't think my wife will make me one either. Anyways, we got exercising. Exercising great. Why? Okay, exercising's great. Yeah, we all know that. Okay, but aerobic activity. So doing things that aren't going to ramp you up too much. That aerobic activity, the brain releases nice, happy endorphins to help calm those nerves that might be up here. Helps calm those nerves down. Once again, is that going to get us down to zero? No. But, they talk about that runner's high that some people get after they work out. That's a real thing. That's your brain rewarding your body for exercising, because your brain wants to do 2 things: survive and reproduce. When your body's stronger and more fit, you're more likely to survive and reproduce. Then we got, we can talk about diet. It's less processed things better. That's a whole other can of worms. Dietitians, that's wonderful. Just quick pro quo on that. We know that with eating a lot of red meat can cause increased inflammation throughout the body. So even there, are we getting those fruits and veggies? Are we getting a lot of processed foods? That makes a difference. Two things left. One, mindfulness. I like to use the mindfulness with the exercising. Are we getting chances to listen to our body? Are we getting chances to know that what's a normal pain, what's a normal ache and pain from what I do, and what isn't. It's a chance to listen to your body. Mindfulness is kind of a bigger thing going on nowadays. I like to use it when we're exercising, when we're stretching. It's basically just a chance to listen to the body. Last thing we got, I'm looking at my post-it notes because I'm trying to remember all this stuff. Deep breathing exercises. So we got 2 systems real quick that control our nervous system kind of as we're going through our day. We got our sympathetic nervous system, our parasympathetic nervous system. Our sympathetic nervous system is for the fight and flight. It's times when it's like, hey, I gotta run for the bear, or I gotta push somebody else over because the bear's gonna get them because I'm not fighting a bear. They're too big. And basically, it's sometimes with pain that sympathetic nervous system, that overactive nervous system, is a little overactive, and it increases that blood pressure. It increases that heart rate. It increases muscle tension. We're a little more on edge, and those stress levels are going throughout the body. So just with some nice deep breathing exercises, activities are just nice rhythmic, in 3 seconds, out 3 seconds, and pause in between. So, and just doing that throughout the day and controlling our breathing and helping to control our heart rate can help ramp those things down. So those are all ways you yourself can help control any issues with persistent pain. Obviously, we can keep talking about this for hours. I can talk about this for hours. Let's go. There's a lot of things that we can do to help you out. I'm Thomas over to Spire Rehab Center, physical therapist. Have a nice day. Bye.